everyone, I'm Jenny Odani and I'm the Extension Veterinarian with the University of Hawaii at Manoa College of Tropical Agriculture and Human Resources. This video will cover the basics of evaluating the health of sheep and goats, especially as it relates to their parasite levels. The first part of the 5-point health check is body condition scoring. You have to actually put your hands on the animal to score them properly, especially in sheep because of their thick fleece. By first palpating the spinous processes, which are these here that you can palpate directly on the midline of the animal. And the next thing you're going to want to palpate for are these transverse processes that kind of stick out to the sides along the lower back of the animal. You'll also want to palpate the muscle that kind of fills in the gap along the back of the animal. We call that the loin eye muscle, and you'll want to get an idea of how big it is, how big the actual muscle mass is, and you're also going to try to get an appreciation for the thickness of the fat cover. I've included here a table that describes the key features at every body condition score, with 1 being an emaciated animal, all the way to 5, which is an obese animal. And in the slides that follow, I'm going to show you a couple of pictures for some reference. Depending on the animal's stage in the reproductive or production cycle, you generally expect them to be between 2.5 and 4. Here on this slide, I show you 2 examples of goats that represent body condition score of 1 and 2. Notice that this animal on the left has also a very rough hair coat, and it's a little difficult to see the top line of the animal exactly, but you can see that there's this thing that kind of sticks out and the big gap. And if you were to actually put your hands in the animal, you'd be able to feel the spinous processes on the top and the transverse processes on the side, on either side, really easily. In this animal here, again, you'll be able to feel these individual bones pretty easily with just minimal pressure along the midline of the back. And these transverse processes on the side would be pretty easily felt as well. In this slide, I show you 2 photos of animals that are roughly in the ideal body condition, so about a 3 out of 5, although the sheep that's on the left is probably more like a 3.5. If you want to, you are allowed to use half scores, if you think that the animal's kind of in between areas. In this slide, I have 2 animals that are overconditioned. The goat on the left is a 4 out of 5 body condition score, and the sheep on the right is a 5 out of 5 and is obese. You would have to put your hands on the animal to be sure, but this would be an example of an obese animal. The second part of the 5-point check for health is to assess whether or not the animal has edema or swelling of the jaw. This condition is commonly referred to as bottle jaw and can be a sign of parasitism. This is the area here that you're going to be looking for bottle jaw, and the normal contour of this area of the animal would probably run something more like that. And if you were to put your hands on this, you would feel that it would be a little bit jiggly, maybe like jello, so like a soft swelling. The third thing that we look for in the 5-point check for health are external evidence of diarrhea, or DAGs as they might be referred to in sheep. There are charts that you can use to score the degree of soiling in the britches area, extending from the rectum and onto the legs in more severe cases. This finding isn't specific for internal parasites. Keep in mind that things like stress, change in diet, maybe specific diet types can also cause diarrhea. The fourth feature that we check for is the Famacha score. Famacha is named after the veterinarian, Dr. Fafa Malan, And this is his chart. So Famalan chart, Famacha scoring. And this chart matches the color of the animal's conjunctiva here with a color score. So it goes from 1, 2, 3, 4, and 5. And this color score will correlate well to the level of anemia in the animal. Scores of 1 and 2 are good. And if your animal scores in this area, it's not likely to be anemic. That doesn't mean that it doesn't have parasites. Almost certainly it does, but at least it tells us that the level of the homunculus or the barber pole worm is not high at the moment. If your animal scores in the 3 zone, this animal might be okay, but it would require that you take into consideration all the other parts of the physical exam, like the body condition score, whether or not bottle jaw is present, or if there's evidence of diarrhea, and what the coat condition looks like. If you have an animal that really appears healthy in all other respects, but shows up as a 3, that's an animal that probably doesn't need to be dewormed, but you would want to regularly follow up and check the Famacha score again because things can change rapidly. Scores of 4 and 5 require treatment. An animal like that is shown here has a Famacha score of, if I could make this a 6, I would. It's very, very, very pale, and this animal is critically anemic. You can use the Famacha score to actually detect severe barber pole worm infections even before the number of eggs seen on fecal testing will tell you that there's a problem. And if you have questions about this or would like to become certified to do your own Famacha training, contact your veterinarian or your extension agent. And online training is also available. I'll give you guys the link on the last slide. The only really tricky thing about doing the Famacha scoring is to make sure that you're observing the proper area of the conjunctiva and to remember to check both eyes. This photo shows you the proper technique for performing the Famacha test. You want to perform it in good lighting, and you want to have a reference chart that is plastic laminated to prevent it from fading with the sun. The person who is manipulating the eyelids is using a combination of downward pressure, so they're actually using their fingers to kind of press down on the eyeball, pressing it down into the head. And at the same time, they're using their fingers to also flip the eyelids back gently, and that's causing this pink tissue of the conjunctiva to pop out so you can see it easily. The last part of the 5-point check is to examine the animal's coat and nose for any parasites such as lice or nasobots. So the lice, are things you might be able to see. You'll have to get your hands on the animal and actually part the hairs to look for the lice themselves, or perhaps the nits that might be attached to the hairs. And you're going to want to examine the nose for nasal discharge that can indicate the presence of lungworms or pneumonia, or there might be nasobots in there as well. A clinically parasitized animal would generally show a decreased hair quality and quantity. So that's why we want to remember to kind of take a look at what's going on with the skin and coat. In addition to the 5-point general health assessment for the internal parasites, we also have some specific tests that can help us understand the parasitism status in our flock or herd. These include the general fecal examination, the fecal egg count, the fecal egg count reduction test, and larval development assays such as the drench rate. The general fecal examination is usually done as a simple flotation test. This test can tell you the general types of parasites that your animals have and can give you an idea of the relative numbers. One limitation of the test, however, is that the eggs from many of the parasites that sheep and goats have look alike, so it can be hard to know exactly who the bad actors are in your herd. A fecal egg count is a similar type of assay, and this allows you to quantify the concentration of eggs in the feces. It will help you determine the number of eggs per gram of feces, and that is used to estimate the level of parasitism in the animal. The logic behind that is the more parasites the animal has, the more eggs those parasites lay. This test will typically count all of the strongyle eggs together. So, again, a lot of the parasites that sheep and goats have, their eggs are indistinguishable from one another. Other things that we might count, which look a little bit different, would be the strongyloides eggs that are a little bit smaller. Tapeworm eggs look different. And then there are some other weird ones that might come out. We can find whipworms, and for sure we would also count the number of coccidia that the animal would have. And this is the type of device that we use. You can buy these on the internet from some, reputable sources. And what they have is a grid. And there's a certain way that we prepare the feces to make a uniform slurry, and we load the grid and we count the number of eggs within that grid. And there's a simple calculation that you'll use to calculate the number of eggs per gram. A similar and related test is the fecal egg count reduction test. So what that basically means is we're going to do the fecal egg count, and then you're going to deworm your animal, and then we repeat the fecal egg count 10 to 14 days after the last dose that the animal received. There might be some variation depending on specifically which parasites we're looking at in your animals, but 10 to 14 days is a pretty good range. And what we're doing is we're calculating the number of eggs that are present after the deworming compared to the number that were there before. And if your dewormer works, if you pick the right product and you administered it properly at the right dosage, we would expect there to be very few eggs left in the feces after the deworming. If you don't achieve 95% or greater reduction, then that tells us that you have a resistance situation in your herd. So this beautiful, colorful test is the drench right test, which is the larval development assay that's performed at the University of Georgia. And in this test, they will actually take the eggs from the feces and they will hatch the larva out from them. And by examining these tiny little larval worms, you can actually make an accurate identification. Remember how I told you that the eggs for a lot of these parasites look the same? Well, the larva to a certain degree can be distinguished from one another. The other thing that this test allows us to do is to test those larvae for resistance to the 3 classes of dewormers. So here's one, the second, and then the third. And what she does when she runs this test is she will evaluate different levels of the dewormers, and she can give you a pretty good idea of what the level of resistance it would be predicted at your herd or in your herd. This test works best when the barber pole worm is the primary type found, and one limitation is that to get this test done, it requires a large amount of feces to be submitted, and usually that means that you have to pull samples from multiple animals, and those samples have to be very, very fresh feces collected directly from the animal's rectum. The samples will be rejected by the lab if the poop touches the ground, because of the level of contamination that can happen, in just, seconds. So this is something that if you do want, definitely please talk with your veterinarian or extension personnel, and we can kind of talk through the logistics of this. And finally, as promised, here are 2 very, very useful websites. I feel that the wormx.info, which is the website put up by the American Consortium for Small Ruminant Parasite Control, has some of the best updated information out there for you. And I highly recommend that you visit this site for further information. And then for the online Famacha certification, you would go to this website, and the wormx.info also has a link to this program, and this is where you can read through what is required for the online Famacha certification. And with that, I thank you for your attention, and if you have any questions, please feel free to contact me through the organizers of this field day presentation. Thank you.